Hello, Dr. Childress here. Welcome. I'm talking with targeted parents on how to look through the Vitae of the mental health professional that you're interviewing for a job. And you are interviewing them for a job. I know they don't give you that impression. I know that they're kind of arrogant and lordy and haughty and all that kind of stuff. I understand that. They shouldn't be. They really, really shouldn't be. They work for you, and they don't realize that because they've got a narcissistic kind of stuff with them. And that's really dangerous because a narcissist is incapable of empathy. So they're not going to have any empathy for you, these narcissistic ones. It comes from their own childhood trauma, and they're doing this because they're working out their own trauma stuff, and they're not very good at it. And they're going to mess with you as a way of doing their own nonsense. But we're working on clearing them out, but it's going to be a while, so you have to walk through the Vita and just make sure they know what they're doing. So look for their attachment pathology or their attachment training. Most of them won't have it. 99% of the people you review will not have a background in the attachment system. Well, what do you do about that? What do you do if they don't have any background in the attachments? You're screwed. Simple as that. Imagine going in, let's say you had a heart problem and you have these heart palpitations, and you go in and you go into a physician and you need like open heart surgery or you're going to die. And then you come back and say, my physician doesn't know anything about the cardiac system. He doesn't know anything about heart surgery or heart problems. Well, should you choose that person? No, because they're going to do open heart surgery on you and you're going to die because they don't know anything about open heart surgery. They're ignorant. They know nothing about open heart surgery. So I pretty much guarantee you, if you do open heart surgery with that person, you're going to die on the operating table. And so now you're coming back to me and saying, well, Dr. Childress, I can't find anybody who does open heart surgery. And I need open heart surgery. You're screwed. You're going to die on the operating table. That's just a matter of things. And so that's the situation we're looking at. That's why I wrote Foundations. I'm trying to jumpstart, trying to scaffold at least some knowledge into people. So if they've said, where'd you get your attachment training? He says, I read Foundations. Great. Okay, that they have a knowledge base there. Okay, I read Foundations and and so that would be a criteria. Did they have their read Foundations? If they haven't read Foundations, give them Foundations and say, would you read this? And they say no. I go away. If they say yes, yeah, quiz them on it. Why haven't they read it before? Kind of stuff. But that's one zone. And Foundations is just a jump start. Okay, none of Foundations is me. None of that is me. It's Bowlby, Mnuchin, Beck. It's standard stuff. It's just that they don't know it, so it sounds new to them. The first time I've ever heard this, well, yeah, because you're ignorant. It's because you don't know Bowlby, you haven't read Bowlby, you haven't read Mnuchin, you don't know anything what you're doing. So it sounds new to you. I understand that, but it's not actually new. So Foundations gives them a little jump start, potentially, but you're not going to find people with attachment. The other thing you want to look for is family systems therapy. Now, what if you don't find anybody with attachment, and you find somebody with family systems? Is that good enough? Probably, actually. You'd want attachment. You want to help them get up to speed a little bit on that. There's some things that is going to be problematic having to do with processing sadness and stuff they may not quite understand. Personality disorder stuff they may not quite understand. But they're certainly going to get the triangulation, cross-generational, and cutoff. And they're going to get that. And that cross-generational coalition has a treatment to it that they're going to understand. And the emotional cutoff has a treatment to it that they're going to understand. So they're going to be able to work it out with you and figure it out. Now what they're going to run into is we have a personality pathology hitting the family system that locks it into place. So they're not going to be able to change the family like they're used to doing because you have personality pathology that's locking it. Whether or not they'll be able to figure that out is questionable. If they have personality background, though, absolutely. And the way you get that is typically you're not going to get any personality experience with narcissists. Narcissists never ever show up to therapy. So there will be no mental health professional out there, probably two, who know about the narcissistic personality. It never shows up. What you will find is borderline personality. You'll find people with experience in that. both individual patients, but they may have worked DBT. If you find a therapist who has DBT, dialectic behavior therapy, it's for borderline personality. If they have DBT background anywhere, good thing. They know borderlines. A DBT therapist knows borderlines. And so you bring your family into a DBT therapist, they're going to recognize border, and they're going to be able to help stabilize things. They're not going to know court involvement stuff, and there's going to be some other problems with that, but a DBT therapist, and you're not going to actually do DBT therapy, do dialectic behavior, that's not going to be part of the therapy, but what it means is the mental health professional knows your borderline. So that's good. So where do we find evidence of family systems therapy? Good luck with that too. Family systems therapy you get in clinical trainings, and it's not a common expertise. Most therapists are going to be trained in behavioral psychology, cognitive behavior therapy, which is a learning theory out of B.F. Skinner and the Rat Lab ones. So you're in a different school over there, behavior therapy. They're the ones that gives you token economies and tell your kids, put your kids on timeout, or response costs, take your kids away, consequences for misbehavior kind of stuff. So those are your behavior therapists. Behavior therapists, if a behavior therapist tells you to give your child consequences for this pathology, oh my God, that's the worst thing to do. No, don't. You're in a position where if you punish your child for misbehavior, for bad attitude, the child's just going to turn that into, I don't love you because you're mean to me. Okay, so it's going to be used against you, the fact that you punish the kid for misbehavior. The other parent's not going to support you on that. They're going to say, oh, you're being too mean to the child. And so don't do what behaviorists tell you to do. I'm a behavioral psychologist. I did parent training many years. And don't do that. That's for ADHD. That's oppositional defiant. That's not this one. So that's most therapists. You'll find a lot of child therapists humanistic existential. Oh, it's growth, and we need to accept the child's feelings and validate the child's feelings. You'll hear that a lot. Validate the child's feelings. Humanistic existential. That's your Eslon growth, self-actualization kind of school. Again, bad with this. Especially individual child therapists from a humanistic existential school is a nightmare with this type of pathology. Why? We're treating a delusional disorder. This is a delusional disorder. You do not validate a delusion. Okay? So the issue for the humanistic existential side is they don't know what they're treating. They don't realize they're treating a delusion. Now, if they do, yeah, there's things about authenticity and congruency of communication and stuff. You can actually use humanistic existential principles to heal the pathology. But first you have to realize this is a delusion. You have to know what you're treating, then you have to recognize cross-generational coalition and stuff. So those are your two big kind of people out there in child and family therapy. You got the behavior therapist, and you got the humanistic, oh, isn't it wonderful kind of therapist. Oh, isn't it wonderful? They're the play therapists. So if you got a play therapist, the child goes in there and plays games with the child, and that's your humanistic existential one. And really, play therapy is kind of pointless. But that's whole separate conversation for me in psychology. But so those are great. So what about family systems? Very small percentage of therapists are family systems, and so you're going to have a hard time finding them. Now, what you will look for, where'd you get your family systems training? So I got it at this place and this place. Ask them, what do you think about Mnuchin? Just ask them, what do you think about Mnuchin? And what you're doing is you're throwing out a probe there to see if they come back with a coherent sentence. I think he's really, really good. Yeah. In what way? What do you like about him? Get him to describe something. Okay. So what Salvador Mnuchin looked at was the structure of the family. It's called structural family systems. And so he looks at structure, and he's into hierarchy. And so the parents should be above the children in the family hierarchy. Parents are in a position of executive leadership. And he's also looking at boundaries between parent and child. So that's where he gets up the construct of enmeshment. comes out of Mnuchin and all family systems, but Mnuchin is one that's talked about a lot, is that boundary violation where you're psychologically in the world of the child and there's a fusion of psychological states. And so you can ask him about that. The second school is strategic family systems. That's Jay Haley and Chloe Madonis. Very few people know that. So it's really good. It's really powerful, but it's sophisticated. It requires a good deal of training. So you're not going to find strategic very often. 1%. Most of it are going to be structural family people. And so you can just ask about Mnuchin and see what they say coming back. The other constructs of that is triangulation and triangles. Triangulation of the child, cross-generational coalition. You can ask the family therapist as you're interviewing, you say, I've heard about cross-generational coalitions. What is that? See if they can explain it to you. It's where the parent and child form a coalition against the other parent, and essentially the parent is diverting spousal anger through the child because the direct expression of spousal anger isn't getting through. Just to explain what the treatment for that is to both detriangulate the child, get the child out of the spousal conflict, and it creates an inverted hierarchy. So we're going to put the child back into a proper hierarchy, get the child out of the spousal conflict. But the other thing is, I need the parent with all the anger, I need them to express that anger to the other spouse and get that pathway open. There's, for some reason, it's not having an impact or not having an effect or not doing, and so they're diverting it to the kid. So I need to get some spousal kind of work in to get that channel open of communication there so it doesn't triangulate the kid in. That's the treatment for cross-generational coalition, by the way. So follow me along to the next one, and we'll continue to talk about looking at your employee's Vitae.